All right, everyone, we're going to now move on to the presentations for today. I'm going to start with a short presentation on our main topic of the conference, which is the introduction of our new Healthy Community Guidelines, which I hope that all of you here will be using going forward. I'm very grateful to our over 100 partners. So we have over 200 partners in Housing for Health. Over 100 of them have been involved in giving inputs into different working groups that have created the Healthy Community Guidelines. All right, so we're going to start with just a short presentation for myself to give some background to this, and then we're going to go into our neighborhood panel. Okay, so Housing for Health and the Healthy Community Guidelines. First slide. Oh, I guess I can advance these slides myself. All right, I think for those working in health here, many of you will know this. For others who are working in other sectors, 44% of Canadians, so nearly half of all Canadians who are adults 20 years and over have at least 1 in 10 common chronic conditions. The most common, high blood pressure or hypertension, affects 1 in 4 Canadians, but also common are diseases of the joint, mood and anxiety disorders, so mental health issues, thinning of the bones, osteoporosis, diabetes, asthma, chronic obstructive lung disease, ischemic heart disease, cancers, and dementia. The determinants of health play a huge role in whether we can make people healthy, physically or mentally, or not. And, you know, I think we often think about access to health services as very important, and of course it is. It's one of the 12 determinants of health. We also often hear about genetics and biology, and of course that plays a role too. But there are 10 other determinants of health that we can potentially play a role in influencing. Social conditions, things like income, social status, employment, working conditions, education, literacy, childhood experiences, physical environment, social supports and coping skills, healthy behaviors, gender, culture, racism. So today we're going to be talking about a number of these and the importance of them. So for example, how physical environments and social supports and healthy behaviors might all be linked and might all be better supported if we think more about the amenities and the design of our neighborhoods, our streets, our buildings, and the sites. There are increasing levels of chronic disease, not just in Canada, but globally. So these diseases, heart disease and strokes, cancers, diabetes, lung disease, they are now the #1 causes of death globally. Over 40 million deaths per year, over 74% of deaths. And you know, I didn't highlight tobacco and harmful use of alcohol because in the Canadian context, we've done actually quite a bit to address these issues in terms of how we regulate their sales, in terms of where premises that sell them can be located, in terms of supports like quit lines. But if you look at some of these other really key factors like physical inactivity, unhealthy diets, and then the chronic conditions that come along with them like diabetes, high blood sugar, high blood fats like high cholesterol, overweight and obesity, high blood pressure, there's a whole lot more that we can do and be concerted about. You know, also I think we very often think, oh, you know, there are links between social supports and mental health, but actually some of these physical factors like physical activity are increasingly shown to be really important in protecting against mental health issues as well. And similarly, social isolation doesn't just affect mental health negatively, it also affects our physical health negatively. So there are social isolation as a consistent predictor of poor outcomes for diabetes, high blood pressure, emphysema, and lower social involvement can actually increase people's risks of getting the first heart attack by over 50%. Luckily, at the same time, research is also occurring that is showing us that how we design our communities, our building environments actually can matter. So community designs that actually make spaces more walkable. So if you have, you know, enough density through different types of housing in a neighborhood, if you connect those types of housing to neighborhood amenities like healthy amenities, parks, grocery stores, those are also places where people work, schools for kids, recreation areas, transit that can take people further if they cannot drive or do not wish to drive. And if you connect them by safe pedestrian and walking and biking paths, if you increase the safety through both crime and traffic-related safety measures, if you increase the aesthetic appeal through art and landscaping, studies have shown that communities designed this way can actually have shown 161% improvements in physical activity, reductions in social isolation, and even reductions in crime, probably from people walking around and having more eyes on the street. Building design plays a complementary role. We spend the bulk of our time in buildings every day. And so whether you can use the stairs, whether those stairs are easy to find and safe and pleasant to use. There are even skip-stop elevators that can be programmed that in very high-rise buildings. And studies have shown that when you program skip-stop elevators, so one elevator for folks with disabilities who are carrying heavy loads will always be there for every floor, but every other elevator is programmed to stop, for example, at every third or fourth floor. Those types of buildings show an over 3,300% increase in stair use. And when they survey those folks, initially, those folks were a little bit, I think, taken aback and surprised, may not be so accepting, but 6 months later, when they resurvey them, often people are actually quite accepting and reporting the benefits that they're getting from using a few flights of stairs every day if they're able-bodied. We need to put more ramps as well, wherever it's possible, so that active living can be a measure for people with disabilities as well. Design and aesthetic interventions like music and art and stairwells, visibility and convenience, natural lighting all play a role in studies that have been done. Healthy food environments as well. If we have supermarkets and places that sell affordable healthy foods, studies show that people tend to be healthier. They have healthier weights, they eat more healthily. Conversely, if we surround ourselves with unhealthy foods, like high densities of unhealthy fast food restaurants, those types of communities have people with higher weights and with poor dietary outcomes. Things like community gardens. Not only are they a place where people can get fruits and vegetables, but studies show that they can socially connect people. They're a form of physical activity, gardening. And so there are these multiple benefits. And, even access to tap water, the sustainable beverage, is important in offsetting potentially, beverages that are high in calories, but that also contribute to the landfill. And it doesn't have to cost a lot more. So when I was working in New York City previously, we actually undertook a study with developers and the housing authorities in New York, San Antonio, and in Atlanta. And we found that new affordable housing could be designed to basically incorporate healthier elements at very little extra cost. And so the maximum increase in cost that we saw over the case studies was 0.4% of total development costs. And in one case, we were actually able to demonstrate a 0.5% savings from the better designs. So if they're consciously done and well-designed, it can be done actually for very little extra cost or no extra cost, or even cost savings. So anyways, when I was in New York, we actually looked at things like, how did this improve our actual hard health outcomes? And we found things like reversals of childhood obesity trends after decades of increases in childhood obesity. We saw that, things like active transportation modes, bicycle travel, use of transit to the central core, all increased. Things like physical inactivity. No physical activity at all in the last 30 days showed significant decline after a lack of change in the previous decade. Life expectancies themselves increased by 2.2 years longer and was increasing at a faster rate than the rest of the United States that wasn't taking this kind of an approach to disease prevention and disease management. And then on top of it, we saw great economic outcomes, like improved retail sales, decreased retail vacancies in the neighborhoods where we increased healthy designs and increased walkability, bikeability, transit access. Anyways, if folks are interested, I was asked to document this in a book called Fit Cities. The bookstore will be here tomorrow and are going to be taking orders for anyone who might want hard copies of the Healthy Community Guidelines. I have a prototype copy that folks can take a look at. It's not quite fully finished, but we printed a prototype copy you can flip through. It will be today at the front desk, and then tomorrow when the bookstore is here at, I think they're gonna come at about 11 o'clock, and they're basically gonna, have a prototype of this at the back as well until about 1 o'clock after lunch. So if you're interested, please come take a look. I told them that if people wanted to bug me to sign the book, I will. So feel free. Just the co-benefits. We've already mentioned some of them, like decreased social isolation, improved safety, the economic ones. Multiple outcomes that can come out for municipalities and communities for doing these kinds of things. So much so that in 2017, the Chief Public Health Officer of Canada basically said, wrote a report called Designing Healthy Living, and it was a call to action for Canadian communities to take action to thinking about their community design and improving that community design to support active living, healthy eating, and more social connections. Anyways, so we're lucky in that in 2018, we got a grant from the Public Health Agency of Canada aligned with this call to action. And it's called Housing for Health here at U of A. We're really pleased and really honored that over 200 partners from 6 provinces have joined us in the process so far. We have these healthy community guidelines, like I said, that are coming out. We were actually hoping that we would be able to actually have hard copies for folks who actually wanted it today at this conference, but we're just shy of it being quite fully done. So hopefully soon after this conference, in June, they will be out. The e-copy, the PDFs, will be available for free. And then, as I said, our U of A, University of Alberta bookstore will be selling hard copies for those who might want a hard copy. And we'll be sending everyone here an email, both on the registrants online and the folks here in person, an email when they come out in June. So please be on the lookout for that. All right. So one of the things is this partnership is meant to create products that all of us can benefit from, that all of us can give inputs into and benefit from. Community engagement, we do workshops with community residents. So we've done various workshops that have culminated in community events where communities are also piloting what they can do on a trial run basis. So recently we've had some street closures where we've brought out, community engagement equipment. People are playing pickleball on the streets, and, there's bouncy castles, there's volleyball, there's food trucks that adhere to these healthier food and beverage guidelines for public events that we were able to do in consultation with Alberta Health Services, Nutrition Services. So take a look at these items. They're all available at our website, uab.ca/H4H. We also have these pilot developments, like I said earlier, in Edmonton, in Whitecourt, and in Leduc. And you will hear about some of them at the conference, I believe tomorrow, and both in the site panel and in the buildings panel. Research and evaluation, so as people move into these pilot developments, as we work with all of you, as we work with community residents, we are actually surveying folks and identifying how their knowledge, their capacities, their opportunities, their practices are improving as we work together in these multi-sector partnerships. And then knowledge sharing like today's conference. So thank you for being here. So healthy community guidelines, really the goal is to improve physical activity, healthy food and beverage access, and social connections through how we design, plan, maintain, construct, renovate, retrofit our buildings, our sites outside of the buildings, our streets, and our neighborhoods. The purpose is to provide both evidence-based as well as practitioner-informed strategies. So they are known to have impact because of the evidence and the science, but they're also known to be feasible because of contributions from many of you here giving inputs into, we think this is feasible. Yeah, I think you should take that out because it's not feasible, that sort of thing. So hopefully it's a very useful set of guidelines. It's meant to complement the many frameworks that we have out here in Canada already. I think many of our frameworks give guidance as to things to think about, directions to move in. But I think one of the things that our partners wanted in these guidelines were more specific strategies. And so we've attempted to put those in and look for the evidence in the science to back that up as well. Target audiences, municipal officials, policymakers, developers, home builders, facility operators, planners, architects, designers, health professionals, even community residents have joined us in the working groups because some of them actually sit on community boards where they give inputs into development and planning proposals that might come their way. And so we're hoping that it could help a wide array of audiences. So in the development of community guidelines, we actually had 7 subgroups. Content area subgroups like neighborhoods and streets, buildings, including building interiors, healthy food environments, and social connections. What can we do feasibly to improve these, and what's the evidence? And then also, we had 3 special lens subgroups. Folks working in rural and smaller communities gave their inputs. Indigenous health and well-being, we had a subgroup where we had Indigenous leaders and partners give inputs. And we also had a subgroup where people of all abilities from different groups representing people of different abilities also gave input. Anyways, some examples, are things that are as common as thinking about healthy mixed use. So I think we talk a lot about mixed use these days in our designs, but I think we want to take that a step further to healthy mixed use, right? There's a lot of difference between a community, let's say, that has a store that sells tobacco, a store that sells cannabis, a store that sells alcohol nearby. So you could still walk to those elements and it might still increase your physical activity. But it would be much better that if we had actually a community and a neighborhood that had a school, a public library, a grocery store, a park. And so, I think as we think about mixed use as a really major way of increasing walkability and active and healthy and sustainable transportation, let's also think about that additional layer of what makes mixed use additionally healthy for social connections and for healthy food and beverage access. Buildings, I think, we want us to think about stairs, but also ramps wherever that's feasible. And the whole variety of parameters from retrofits you can do to those building interior active mobility spaces to things that you can do from the get-go. So if you're designing from the get-go, you can think about where to place the stair. If you're designing to retrofit, that's a different story, but you could still put art into those stairwells. You could put fire-rated glass doors for increased visibility. You can consider where ramps can increase active mobility for people with disabilities as well. Healthy food and beverage access and amenities across buildings. What more can we do, particularly in our non-residential buildings, to support things like healthy tap water access, drinking water access, healthy food and beverage vending that we might have in our buildings, even in our residential buildings, what can we do on the ground floor if you're locating in a food desert community, for example? And then even things like how we design to promote social connections. So one of our postdoctoral fellows previously, who's now she's director of research, I think, in an organization now in China, her qualitative studies showed us that, during the pandemic, seniors who had access to balconies where they could interact with their neighbors actually were less socially isolated because of that interaction out of doors. And so how can we use all amenities for elements that promote social connection, healthy eating, and active living as the 3 key protective factors to many of the health outcomes that we need to improve today? And who can use them? Who should use them? Everyone. So hopefully everyone here, everyone online, and, spread the news. And, in our guidelines at the back, we also have a list of other documents that are available in Canada, other frameworks that you can refer to help guide you. Pilot housing developments, so we have 3, as I mentioned, in Edmonton, in Leduc, and in Whitecourt, and they also represent different types of housing and neighborhoods. So we have a more urban type of area in Canada, a more suburban area in Canada, and a small town of 10,000 away from a metropolitan area. I have 1 minute left. And we wanted also different typologies of housing. So they're all multifamily housing, but one's an affordable housing in an urban site, one's a mixed income housing in a suburban site, and one is a market rate housing, but with different types and levels of care for seniors in a small town. So anyways, we've been working with the developer teams and architectural teams. You'll hear from some of them tomorrow. And also, we've been working with folks like Mayor Young and Mayor Pickard, their councils, with City of Edmonton folks on the neighborhood scale, things that we can do as well for improvements. These are just some examples, right? Everything from the interiors to the exterior on the site to the neighborhoods. And you'll hear about them more tomorrow. I have many folks to thank for basically for this conference happening, as well as for these guidelines happening. You know, you can see the whole list of folks here from Government of Alberta, from ASHA, the Alberta Seniors and Community Housing Association, because many of our developments are targeted towards seniors as a key population group for healthy aging. City of Edmonton, some of the folks are here. Please wave your hand. I see Robert in the audience. If you see your name up there. City of Leduc, City of St. Albert. We have Town of Coaldale and University of Alberta folks as well. I think Danielle Klassen is here. Thank you. And Kate is with her. And then we've had some students who've joined the group as well. And then, you know, I can't thank my team enough. It was, you know, a huge team effort. You could see all the folks who work on our team. I would say let's end this session right now before I welcome up the panel with everyone standing up and just giving a round of applause to the Conference Planning Committee and the Housing for Health team and staff. Thank you so much, guys. Thank you so much. And thanks for the standing ovation.